Thanks so much for watching Making Healthcare Work for You, Different Perspectives and Empowering Solutions. I'm Stephanie Fields, joined by my co-host, Dr. Apoorv Gupta, and today we're welcomed by Dr. Shannon Connor Phillips, who is the Chief Health Officer at Joyous. Thanks so much for being here.
Excited to be with you. Thanks.
So tell us about Joyous, because it's an interesting platform where people can get feedback. Leadership can get feedback on very targeted things that they're looking to improve in a very easy way for people to give the feedback that also utilizes AI.
Yeah, so I fell in love with this company. It is exactly that. So it's a tech platform, a SaaS tool essentially that allows an organization, and I'm bold on it in healthcare, to identify their strategic priorities and target actions with the people doing the work. So if we presume that as executives, we actually don't always know the best thing to do and very often don't, but that the people doing the work do, you have the opportunity to have a connection. So the tool allows you to pick an area of interest that you need to fix, improve, run a campaign, which is essentially asking your workforce a question, two or three, about a topic that is not sentiment oriented. So it's not a survey, it's a discussion or a chat, but rather what ideas do you have to make something better? So you pose a question, they give you an answer back. You have the opportunity, facilitated by AI or not, to express gratitude and ask a follow-up question to get very specific. And so the data, the richness of the qualitative data you get out of a tool like this trumps a survey every day, right? Which is sentiment oriented and sort of an open box of, it's almost like an idea box that could be scattered anywhere. You use it targeted. And then after these conversations, the magic of AI takes over and does the really most unpleasant part, which is the analytics, right? So can you find themes of actions to go do? And those actions are prioritized by the plurality of people who say, my lived experience is this. And if you fixed this, you're taking the pebbles out of my shoes, you're making the care better for patients, I'll like my work better. And boy, we can't afford to lose people in healthcare. So if we can restore some of that joy, I think some of the most important ways we give people joy is actually to have them meaningfully participate in making their work better. And so we've seen that happen in other industries where Joyous started, our company started. And I think in healthcare, many of those same principles matter. People closest to the work know what needs to get done. And we can leverage AI to make the work, the lift of collecting those ideas less, and we can get straight to acting and making the work better.
Shannon, I feel as I'm listening to you, I think we have a lot of similarities in terms of the work we do, trying to drive performance improvement, care transformation, and some of our clinical background. Also, as we were just discovering, I'm feeling that this is a super powered system to generate feedback, which we really struggle with within the healthcare setting to even first figure out how are we going to get that feedback. And then you add in all the AI components that help you allow to actually trend it. So as you were trying to do this work previously without such a tool, what were some of the limitations? Were you actually able to get feedback in manual ways, or ultimately is it impossible to do unless you have a tool like this?
So you're right. We probably have some similar lived experience. So what was mine? We hopefully, an organization has strategic priorities, and someone comes to me as a leader and says, we need to get this done. We're going to put in this new tool. We're going to change our process. And what we would often do, what I've often done, is gone to my leaders and said, hey, here's the problem we're trying to solve. Here's the idea about how to solve it. Poke holes at it. What do you think isn't going to work? And they bring their best, right? And we gather some feedback and share and make that a little better. And I didn't get to that many people, right? I mean, the reality was, in an organization of thousands and thousands of people, I'd be talking to a handful who represented other people, but it's their lived experience, and that it is very either secondhand or their firsthand, which is even smaller. And so we give that feedback, we roll something out, and the many more times than I'd care to remember, the physicians or the nurses or the care team would say, if you had only asked me, we could have avoided this, or you wouldn't have chosen to do it this way. And we simply couldn't get that kind of qualitative information, that detail at scale. And so to me, the magic of being able to leverage technology to have a human conversation, to get that qualitative data at scale, talk to more people. You don't even have to talk to everybody, but if you can get further out into the organization and then let AI turn it and tell you what their most important lived experiences are, we could make a better RFP for a tool. We could make our process better. So whether we were implementing technology or improving the process of care or redesigning the process of care, imagine how much better it would have been if we could have done that with people doing the work. And so that's joyful as a leader. And when I look at other industries that are using the tool today, it is joyful for them. They are excited and honored to participate, and we can make qualitative data quantitative and ultimately make the process of care and their work better. So I'm a fan. I think healthcare needs it.
One thing that you've said several times in the pre-interview was that it's psychologically safe. So tell us why that's such an important element when you're building this and getting these questions out to people to provide the important feedback.
Yeah, no, so when we build a campaign, the intent, and we work very closely with the organization who has a topic to solve, is to be sure that the questions asked are action oriented and, if you will, assume good intent. There's not a blame, there's not a, well, you did this or you this or your team that, but it's actually a sort of a culture of curiosity, if you will. And so it's not anonymous. And we could have a whole conversation about how anonymous is actually very psychologically unsafe, because if you can't have your name attached to it, that suggests that if someone learned about what you had to say, that would be negative for you. So the idea of a conversation with another human being with questions worded in a way that are not about who to blame or it is a very happy, rich place for people. And so when you look at in another industry, we have a large customer, and they're big enough that there was a group that hadn't rolled out Joyous yet and one that had, and the ones that were using it to solve the problems closest to their work were more engaged and more psychologically safe, because they knew that their voice mattered, and they felt comfortable to talk regardless of the fact that people could see them. And in fact, that felt really positive and sometimes very exciting, that you might have a chat with someone that you otherwise didn't know. So foundational to the work in Joyous is to create a psychologically safe, facilitated way to have conversations to make the work better.
You're opening me up to think very differently about this idea of anonymity, Sharon. I really appreciate that. And a couple of additional thoughts are kind of going through my mind right now. Hopefully, I can connect the dots. One is, with the system, what have you found the engagement rates to actually be? Right, you mentioned that in the manual offline version of this, when you were trying to reach out to people, it was very limited in terms of the numbers of people you could reach. So, how many people or percentage of the company or such are you able to reach using this tool? And then, relatedly, I guess my question is, what is the burden that that's putting on those people? Does it feel to them like it's a pleasure and a privilege to be invited to be part of the process, or does it feel to them like, oh, now this is yet one more thing I have to do, just like
Right.
that
Oh,
survey I
another
was.
survey, right? Yay. Right. So I
Yes.
think you have to set it up for success, right? So to sort of say, hey, it's here, we're using this tool, give it a try. So the first time, I'm sure there are skeptics for sure. But the setup really helps. Like, no, this isn't spam. It's not phishing, right? Like, get in it, and you can be texted or emailed, whatever, Slack, whatever works in a company. And you could reach everyone. So, right, you could say, wow, we have a 50,000 person organization or an 800 person organization. You can reach everyone. Typically, we would not, right? So, what you'll actually find is that one, what are you trying to solve? Who is the audience, right? Who are the employees that would be closest, who have that lived experience, that do the work every day and can really provide meaningful ideas? And then often you only need a percentage of those people, a fraction of those people to share their lived experience that you can distribute across geography, across days of the week, times of day, right, to really get a sense of the work. So you can, if you will, I'll put burden in big quotes, but ask people to participate at a much smaller scale. And then it is no different and maybe more pleasant than texting your kid, right? So, or your partner, right? So you get a question and you literally can type back an answer as quickly as it takes you to text. And so to me, actually it was, I loved the tool, I loved the AI, but I was like, wow, this is so respectful of people's time. I'm not asking them to come in, you've been chosen for a focus group, come, drive an extra 10, 20 minutes, get up early, miss your kids' breakfast, whatever, and come be with me because I need to talk to you, right? That is probably to me, some of the ultimate disrespect. And it's lovely to spend time, doesn't discount that leader rounding is important, right? I separate. But if you respectfully of my time ask me to contribute, people love that. So I would say it is easy and requires the user interface is simple, doesn't require any extra training, and you're respected because you're chosen and you give feedback. So it's all on the organization to only run a campaign or to ask when they're going to do something about it. The ultimate other side of that is an engagement survey where we ask people at the end, hey, tell me how we can make something better. You get a first pass from people, you get thousands of comments, and many of them often don't hear what was said. So we don't always close the loop, and we don't do a lot of what was there. And so the opportunity to be specific, be able to communicate what we're going to do and what we're not going to do is closed loop and infinitely more respectful of people's time. So it's much shorter. Can answer in a minute.
And it's interesting because you said that it's a 3-question series and 1 per week. So it's not overly burdensome in that way. But once you get that very detailed, targeted information from a broad group, because as you explained, when you were in leadership roles previously, you'd reach out to people, but human nature, you're reaching out probably to people you've worked with, people you feel like you can trust, whereas this, you can identify people in different ways. And then maybe even get different types of feedback based on different places within the country. So once you have that data, do the leaders within those individual, you mentioned working in Utah. If you had a Utah base, would somebody, when you have these results in the Utah location, then filter down and start taking action in those, whereas somebody in Massachusetts might have a very different set of deliverables after that?
So, right, you can sort the data all those different ways, right? So really important. You might say, wow, everyone, say you're a 21 state organization, right? That every market we're in has these 3 problems, right? You might work at a system level, at an enterprise level on solving that, easing the way. What are the ways to make that better? Using the list of ideas to get things done from everyone. And just as importantly, culture's local, right? And the lived experience has a very local flavor. And yes, it might be a state, it might even be a city, right? Like a market where there's something very specific that needs to be done. And so that data can be sorted, the idea generation can be sorted any which way that would be most impactful to the organization. So the answer is yes and, right? So it can go as big or be as narrow as is helpful to the organization. And I think that's our job, is to really give that valuable, precious idea generation back to the organization to then decide if it's a market issue, if it's an enterprise issue, and all of the above is possible.
Shannon, I wanted to maybe piggyback on your last answer because that's what was going through my mind is the idea that you're driving really a pretty big culture change through a pretty simple tool. And if you ask me as a performance improvement expert, I would say this is an incredible tool. We need this. If we're going to drive improvement at any of our organizations, this is essential. So we always try to help our clients understand how they're going to, get engagement, participation, feedback. It's one of the most essential ways in which to drive sustainable improvement. Yet at the same time, I guess I'm framing this question this way because we struggle because it's culture change, mindset change. You're trying to get people to think in terms of improvement. You're trying to get them to think that it makes sense to actually include people and create a culture of openness and vulnerability. Massive culture change, actually, even though it's a simple tool. So, how do you broach those aspects of culture change as you're implementing this tool? How do you anticipate helping your clients understand all the changes they're going to have to bring about in order to make the use of this tool successful?
Yeah, so you touched on a couple important things. I think the best customer, if you will, of Joyous is an organization that recognizes the importance of cultural transformation, right? If you put in a tool like this or something else and you seek people's voice and then you don't do anything with it, it's worse than not asking in the first place, right? So there's some that sort of initial feel for, are you an organization that everyone knows healthcare is changing, but are you one that is ready to change and values the voice of your employees in the change, right? So if you can answer yes to those things and you know you're going to change, then you're ready to use this. And I think then it's our team, I think, very strategically helps people with the psychological safety piece. So making sure that when you frame your questions, and often as the executives, we're racing to get it done as fast as we can move at speed, and it's not the what, but the how. How do you show up with the questions you ask, with the idea generation, celebrating the idea generation, celebrating what you are going to do, and sharing what you can't? That candor and humility is very important. And so we're a tool, right? We're not the people who are coming in to help people change their culture. I think we need to listen for the organization to want to use the tool in a way that amplifies safety, and hopefully that builds into everything else they're doing to create the best place for people to work and the best place for people to get healthcare.
That's awesome. Thank you so much for being here and telling us all about this. It sounds amazing.
Thanks for having me.
And thank you all for
Incredible
watching.
solution. Yes, incredible solution, Shannon. I can't wait to get my hands on it myself and help some clients use this as well if
We'll
possible.
talk soon.
Yes.
Thank you all for watching. We'll talk to you soon. Bye-bye.